Good morning, class. Today, we'll examine the healthcare product industry and its impact on sexual and reproductive health, SRH. This industry is responsible for creating the tools and medications that improve health outcomes and quality of life. Pharmaceuticals, these are chemical or biological drugs used to prevent or treat diseases. In SRH, this includes contraceptives, hormone therapies, antivirals, and fertility drugs. For example, combined oral contraceptives regulate menstrual cycles, prevent pregnancy, and can even reduce acne. Diagnostics, these tools help identify diseases or monitor health status. In SRH, diagnostics include HIV tests, pregnancy tests, ovulation kits, and fertility assessments. Without accurate diagnostics, treatment or preventative interventions may be delayed or misapplied. Medical devices. These are instruments or machines that aid in prevention, monitoring, or treatment. In SRH, examples include IUDs, fertility monitors, ultrasound machines, and fetal monitoring tools. Innovations in these areas allow patients to make informed choices, reduce disease burden, and improve survival rates. SRH innovations specifically empower people to control fertility, prevent sexually transmitted infections, and manage reproductive health with privacy and autonomy. Having introduced the industry and its main product types, we will now see how these innovations translate into real health outcomes. Healthcare products don't exist in isolation. They have a direct impact on population health and individual well-being. Advanced imaging, ultrasound for maternal health, early detection of fetal abnormalities or complications like ectopic pregnancies can prevent maternal and neonatal deaths. For example, in rural areas, portable ultrasounds allow midwives to detect complications without sending patients far from home. Hormonal and non-hormonal contraceptives. These reduce unintended pregnancies and associated health risks while also giving individuals reproductive autonomy. Non-hormonal methods like copper IUDs avoid hormone-related side effects. These innovations improve both mortality and morbidity statistics, allow proactive reproductive management, and reduce long-term healthcare costs. Transition. Beyond general health improvements, SRH innovations increasingly empower self-care and patient control. SRH innovations go further by addressing preventative and long-term management needs. HIV antiretrovirals, ART, and PrEP. ART enables people with HIV to live healthy lives, while PrEP prevents infection in high-risk populations. For example, a sex worker taking PrEP daily reduces her risk of contracting HIV by over 90%. HPV vaccines. These vaccines prevent infections that can lead to cervical cancer, saving thousands of lives annually, especially in low-income countries where screening is limited. Home-based tests. Pregnancy tests or at-home HIV, STI kits allow individuals to monitor their health without immediate clinical supervision, increasing privacy and early detection. These tools expand access to healthcare, especially for people in remote or culturally restrictive environments, and demonstrate how technology can promote patient autonomy and equity. To understand how these innovations come about, we need to look at the industry structure behind them. The medical device and diagnostic sector is highly fragmented, with many small companies innovating quickly. Globally, there are 20,000 plus companies, many with fewer than 50 employees. This allows small, nimble companies to compete through iterative improvements rather than breakthroughs. The sector produces over 80,000 device models, ranging from simple pregnancy tests to complex ultrasound machines. SRH examples: IUDs and implants provide long-term contraception. Ovulation kits and fertility monitors help couples conceive. Portable ultrasounds allow clinicians to track fetal growth in low-resource settings. Devices often have short life cycles, 18 to 24 months, meaning companies must constantly innovate and adapt to remain competitive. This encourages fast-follow innovation, improving existing products incrementally rather than creating entirely new ones. Unlike devices, pharmaceuticals operate in a more consolidated and regulated environment. Pharmaceuticals and biologics are dominated by fewer, larger companies because drug development is long, expensive, and risky. biotech companies have introduced over 200 therapies critical to SRH, including HPV vaccines and HIV treatments. Developing a drug typically takes 15 years and costs $800 million to $1.2 billion, including preclinical and clinical trials. For SRH, implications, rare or socially sensitive conditions like infertility or endometriosis often receive less investment because the commercial return is uncertain. On the other hand, products like ART or contraceptives have high market demand, which justifies the cost of development. Despite these structural differences, all healthcare manufacturers rely on core development capabilities. Every healthcare company must master 3 critical capabilities: evidence generation, demonstrating safety, efficacy, and comparative effectiveness. For instance, a new IUD must show that it prevents pregnancy effectively and has fewer side effects than competitors. Regulatory alignment, aligning research with approval standards in different countries. A contraceptive may meet FDA standards in the US, but require additional trials for European or African markets. And dissemination, ensuring clinicians, patients, and policymakers understand the product and its benefits. Effective communication prevents misuse and improves adoption. SRH-specific challenge, products often face social, cultural, and political sensitivities which can affect acceptance even if the science is strong. Now, let's examine how investment patterns influence innovation in SRH. Research and development investment in SRH differs between devices and pharmaceuticals. Devices, lower per product cost, frequent updates, and incremental innovations allow faster iteration. For example, a new IUD design can be tested and modified quickly based on provider feedback. Pharmaceuticals require high-cost, long-term investment, making market predictability essential. For example, developing a new antiviral therapy may take over a decade and hundreds of millions of dollars. Implications for SRH, rare or socially sensitive conditions like infertility or endometriosis often receive less investment because commercial returns appear limited. On the other hand, products like ART or contraceptives have high market demand, which justifies the cost of development. Despite these structural differences, all healthcare manufacturers rely on core development capabilities. Investment decisions are closely tied to regulatory pathways which determine how quickly products reach patients. Devices, risk-based approval classifications, Class 1, low risk, condoms, simple diagnostic strips, Class 2, medium risk, pregnancy tests, STD kits, often approved via the 510(k) pathway, Class 3, high risk, implantable contraceptives or fertility treatment devices, require clinical trials. Many devices avoid lengthy clinical trials, which accelerates access to patients. Pharmaceuticals and biologics follow a more structured and rigorous development process than devices, largely because of the higher risk associated with chemical and biological interventions. Phase 1 trials involve a small group of healthy volunteers or patients to evaluate safety, determine safe dosage ranges, and identify side effects. For example, a new antiviral for HIV is first tested in a small population to ensure it doesn't cause harmful reactions. Phase 2 trials expand the study to the target population to assess efficacy and further monitor safety. Here, researchers might evaluate whether a new contraceptive pill reliably prevents pregnancy while tracking side effects like nausea or headaches. Phase 3 trials are large-scale, randomized controlled trials to confirm effectiveness and monitor adverse reactions in diverse populations. For instance, long-acting injectable contraceptives undergo Phase 3 trials in multiple regions to ensure they work reliably across different ethnic and age groups. This multi-phase approach ensures that drugs entering the market are both safe and effective for the intended population. While drug development is rigorous and slow, SRH devices often reach patients faster due to regulatory differences. Unlike drugs, many SRH devices can be approved using alternative evidence pathways. Bench testing and observational studies can demonstrate that the device performs safely and reliably without requiring full-scale trials. Equivalency studies compare a new device to an existing one to show it is substantially similar in safety and performance. For example, a new IUD with a slightly modified insertion mechanism can often use 510(k) clearance instead of lengthy clinical trials.
Many SRH devices are incremental improvements rather than completely new inventions. This approach allows faster market entry while still enhancing patient experience. Caution: rapid approval does not automatically translate into adoption. Clinicians must be trained, and users must perceive the device as safe and convenient. After devices and drugs reach the market, attention shifts to real-world effectiveness, which often differs from controlled trial results. Once SRH products are in use, their performance in everyday settings is critical. Regulatory approval primarily ensures safety and efficacy under controlled conditions, but real-world effectiveness can vary due to patient behavior, adherence, or social factors. Large-scale post-market studies are often needed to evaluate outcomes across diverse populations. For instance, adherence to daily oral contraceptives may be lower in real-life settings compared to clinical trials, affecting overall effectiveness. Conducting these studies is expensive and time-consuming, which can discourage investment in products with lower commercial return, such as infertility diagnostics or less widely used contraceptive methods. Without evidence from real-world settings, clinicians and policymakers may hesitate to adopt or recommend new SRH products. These challenges influence which innovations reach the market and how they are prioritized. Focusing primarily on breakthrough products may unintentionally stifle incremental but valuable improvements. Example: a new contraceptive pill with fewer side effects may not appear cost-effective to insurers, even though users may prefer it and adhere to it better. Innovations that improve user experience or convenience, like easier IUD insertion or discrete fertility monitors, can significantly affect adoption, yet they may be undervalued in traditional market analysis. Balancing commercial feasibility with patient-centered innovation is essential for meaningful improvements in SRH outcomes. Let's explore how evidence is generated and evaluated throughout a product's lifecycle. Evidence is gathered at different stages of a product's lifecycle. Pre-approval evidence focuses on dosage, safety, target population, and initial effectiveness. For example, a new hormonal contraceptive is tested for side effects, ovulation suppression, and interactions with other medications. Post-approval evidence monitors long-term safety, cost-effectiveness, comparative effectiveness, and adherence. An IUD may be tracked for device migration, complications, or long-term user satisfaction. Continuous monitoring is critical, as reproductive health products can have long-term effects and social implications. Post-market studies help identify rare side effects and inform clinical guidelines. Despite careful monitoring, uncertainty is inherent in SRH product development. Several factors contribute to uncertainty: biological variability, hormonal responses differ between individuals affecting drug efficacy or device tolerability, social acceptance, cultural beliefs or stigma may limit uptake regardless of product quality, provider practices, variations in training and experience can influence outcomes, such as the correct insertion of an IUD, policy and politics, legal restrictions or funding changes can quickly alter access to SRH products. Companies must anticipate and adapt to these uncertainties to ensure successful adoption. Provider expertise is crucial for bridging this gap. SRH devices often require specialized training. Experienced clinicians achieve better outcomes. For example, complication rates decrease with repeated IUD insertions. Real-world applications may extend beyond original indications, such as using hormonal therapy for conditions like PCOS or endometriosis. Providers' feedback informs product redesign, improving usability and safety in subsequent versions. Effective training and experience are as important as the product itself. Beyond clinical adoption, accurate interpretation of evidence is essential. Two pitfalls must be avoided: clinicians relying only on personal experience without considering broader evidence, and technical experts ignoring clinical context. Evidence-based SRH care requires collaboration between clinical specialists and methodological experts, ensuring balanced interpretation that informs safe and effective use. Evidence can be miscommunicated if dissemination is restricted. Manufacturers may only share evidence related to the approved label. Off-label uses, even if supported by research, cannot be marketed. Academic publications, media, and patient advocacy channels may share additional information, sometimes leading to knowledge gaps or confusion. Example: alternative contraceptive regimens may be scientifically sound but cannot be promoted by the manufacturer. Digital platforms can help bridge gaps in access to information. Digital tools have transformed SRH outreach. Search engine optimization, paid advertising, and social media increase visibility. Telemedicine and patient portals allow confidential consultations and access to information. Data analytics optimize campaigns, track engagement, and refine targeting. Example: rural adolescents can learn about contraception and STI prevention online without needing to travel to clinics. Evidence alone does not guarantee practice change. Implementation matters. Even when strong evidence exists for SRH products, real-world adoption is often slow. Several factors contribute to this gap. Provider overload. Clinicians often face heavy patient loads, leaving little time to incorporate new guidelines or technologies into practice. For example, a busy rural nurse may continue using older contraceptive methods simply because the new options haven't been fully integrated into workflow. Slow updates to clinical guidelines. Evidence may exist, but official protocols take time to revise. A newly approved IUD with fewer side effects may not be listed in the National Family Planning Guideline for months or even years. Patient non-adherence. Even when products are available, patients may not follow recommendations consistently. For example, daily oral contraceptives require strict adherence, and missed doses reduce effectiveness. Lack of decision support tools. Providers need easy-to-use systems to guide choices in real time. Without these, adoption of newer SRH products can be inconsistent. Studies show that only around 55% of patients receive the recommended SRH care, demonstrating the importance of addressing these implementation barriers. In addition to provider challenges, patients themselves require accurate and accessible information to make informed reproductive health decisions. Today, patients are more proactive and often seek information online about contraception, fertility, and STI prevention. However, information overload, the sheer volume of online content, can be confusing or contradictory. For instance, some websites recommend contraceptive methods without citing evidence, leading to misconceptions, or inaccurate or misleading content. Unverified sources may exaggerate side effects or promote ineffective methods, increasing patient anxiety or non-adherence. Solution: healthcare professionals must provide clear, credible, and accessible guidance. Examples include using structured patient education materials, visual guides for contraceptive methods, or interactive telemedicine platforms that allow patients to ask questions confidentially. This ensures that patients understand risks, benefits, and correct usage, ultimately improving adherence and outcomes. Clear information and proper guidance also depend on addressing industry-level challenges that influence product development and use. The SRH industry faces multiple challenges in ensuring products are used safely and effectively. Increasing scientific complexity. New technologies like long-acting injectables, fertility monitors, or gene-based diagnostics require more knowledge for correct use. Reduced trust in industry-generated evidence. Past controversies or misinformation can make clinicians and patients skeptical even for scientifically validated products. Inconsistent standards for evidence. Regulatory bodies may differ in what data they require, creating confusion about what constitutes approved evidence. Unpredictable payer coverage. Insurance or public health systems may not reimburse certain SRH products, limiting access despite proven efficacy. Limited evidence for non-pharmaceutical interventions. Behavioral interventions, counseling, or educational programs are often critical, but often underfunded or inadequately studied. Addressing these issues is crucial for ensuring that SRH innovations are safe, effective, equitable, and widely adopted. Let's bring all these ideas together in our final conclusions. In summary, the development and use of SRH products are shaped by interconnected scientific, regulatory, economic, and social forces. Evidence generation. Producing robust, real-world data ensures the products are safe, effective, and appropriate for diverse populations. Regulatory and reimbursement pathways. Predictable approval and funding processes accelerate access and adoption. Dissemination. Clear communication to clinicians and patients ensures proper use and enhances uptake. Implementation at the point of care. Evidence must translate into actual clinical practice, not just exist in research papers. By aligning innovation, evidence, communication, and practical application, SRH products can truly empower individuals, expand access, and improve reproductive health outcomes globally.